Okay, so I'm going to attempt to demonstrate 3 different types of injections. We're going to start with sub-Q. We're going to also see intradermal and then intramuscular injections. So starting with sub-Q.
For average size clients, spread skin tightly across injection site or pinch skin with non-dominant hand.
Okay, so we're going to use the injector site here, and we're going to pinch the skin with the non-dominant hand.
Inject needle quickly and firmly at 45 to 90 degree angle. Then release skin if pinched.
Making sure that you look at where your bevel, again, you want to always deliver bevel up, okay? It helps with the insertion. It helps the needle to slide into the skin so that your injection is not painful to your clients. That's why some clients say, oh, this nurse gives a better injection than another, because that nurse makes sure that she always delivers the injection bevel up.
For obese client, pinch skin at site and inject needle at 90 degree angle below tissue fold. Inject medication slowly. Must know abdominal, deltoid, or thigh.
Okay. Should have had that alcohol already in my hand. Hold the site.
Intramuscular.
Make sure you evaluate the site, that it's not bleeding, and once you're assured that it's not bleeding, then you can go on to your next skill. If you need a Band-Aid, then apply a Band-Aid. Please make sure that you readjust your client's clothing and make them comfortable. All right.
Intramuscular.
Okay.
Position non-dominant hand just below site and pull skin approximately 2.5 to 3.5 centimeters down or laterally with ulnar side of hand to administer in a Z-track. Hold position until medication is injected with dominant hand. Inject needle quickly at 90 degree angle into muscle.
Okay, so we're going to start with a vastus lateralis injection. And what you want to do is make sure that you have your landmarks. So we're going to begin with the patella and the trochanter, and you're going to go inward to make your diamond shape, and then you're going to rotate just a little bit lower so that you're not giving it on the top of the thigh, because what injection is that? Make sure you look it up. That's for your pediatrics. You're going to go down and you're going to use your diamond. So this is my site right here. So I'm going to then get my alcohol wipe, and I'm going to clean my area in a circular motion. Allow it to air dry. If I'm doing a Z-track, I would have tightened the skin before using the side of my hand. Put your alcohol right there. Remove your cap. Again, remember, bevel up, so make sure you look to find out where the bevel is. Okay? You're going to make a quick but not stabbing insertion of your needle. And what do you need to do this time? You need to pull back and make sure that you do not get a blood return. If you get a blood return, that means that you're into a vessel, and you don't want to be into a vessel. You're going to deliver your medication. Slowly. After all the medication is delivered, you're going to remove your needle, remove your Z-track, and place a alcohol wipe over your site. Put that in there. I'll do that later. Hold it for just a little bit. Making sure that your client is not bleeding. Determine whether or not there's a Band-Aid needed if your client is bleeding. Okay, everything looks good. No bleeding, no Band-Aid is needed. Reposition my client. Also, we're going to do a deltoid. Let's do a deltoid. The deltoid is also a intramuscular injection. So how do you find the deltoid? For the deltoid, let's see if I can move him so that his arm is up a little bit. I don't know if you guys can see it. Can you see it okay?
No. Trying.
Let's turn him sideways. Now, he's kind of heavy. Okay, Mr. Johnson. There we go. Can you hand me a pillow for my client? He doesn't have a pillow. There you go, Mr. Johnson. Thank you. Okay, there he goes. Now can you see his deltoid? Okay, you can see that there. Okay, I actually need one more pillow. Can you hand me one more pillow? Because many of you have asked to see the skill over and over again. So we're just trying to find a way so that we're using your skill and providing you with a method that you can go and watch it, practice, watch it again if you need to, and continue to practice until you become proficient at your skills. So you guys will, of course, tell us how this works. Okay, so for our deltoid, we're going to find the acromion process. We're going to place 2 fingers there. We're going to take the other hand, well, let's do it this way. We're going to take our other hand and develop a V over the acromion process. Now the mannequin has your whole site here. So this is where we're going to give our deltoid injection. Okay. We're going to start and clean our site, starting from inner to outer. Allow it to air dry. Okay. And we're going to give, again, bevel up. Nice injection. Aspirate back. Blood return. Slow delivery of your medication. Remove. Apply pressure. Now some of the needles have a safety device. You can engage that safety device. If it doesn't have a safety device, then you want to try to put your needle into your needle disposable biohazard waste container as soon as possible, so you don't injure yourself. Okay, he's fine. He doesn't need a Band-Aid. He's not bleeding. Great. Okay, let's do, let's see if he has, yes he does. See if we can turn him just a little bit more. Oh, how about if we let the head of his bed down some? That might be why he's not turning. There very well for me. Head down. Make sure your rail is always up on the other side. You're going to be turning your client. Okay. Now here, with this injection, you are going to, first of all, find your landmarks. Now this site is actually a very good injection site for most meds, especially large amounts of medication. So in order to find this site, okay, you find your, see how to do it from this side. Okay, you find your gluteus maximus, so from the lower end up to the iliac crest, and then you cut that in half, and then half again. And your site is right here, and you can actually see on the mannequin, it actually gives you, you are going to be in the outer upper corner. So half and then half toward the out. Why is this important? This is important because coming right out of the spine is that the sciatic nerve. And you don't want to be anywhere near the sciatic nerve. So it comes from the lower spine right down the middle of the gluteus maximus. So that should indicate to you that you are going to be upper, outer corner. So here's your site right here. Inner to outer, allowing it to air dry. Bevel up. Okay, if it needs to be Z-track, then make sure you do your Z-track. What is the purpose of the Z-track? The Z-track is to make sure that the medication that you are delivering stays down into the muscular portion of the tissues. You don't want that medication to be up higher because then it would be very irritating. So use this Z-track for irritating meds, for viscous meds, things like that. So let's back up a little bit. Let's say we're going to do this with Z-track. So I would use the heel of my hand and pull the skin taut. And then I would clean. I would allow it to air dry. And then I would insert my needle. Bevel up. Pull back. Oops, there goes my. No blood return. Deliver my medication slowly. Release my Z-track and cover my site with an alcohol. Make sure your client is not bleeding. If they need a Band-Aid, then please make sure you apply a Band-Aid. Okay, this side is fine. Client comfortable. Now, when you do your medication administration, we're going to choose your site. We're going to tell you, okay, you're going to do a sub-Q and you're going to do vastus lateralis, or you're going to do a sub-Q and you're going to do whatever one the instructor chooses. So that means you need to make sure you know them all. All right, and then lastly, go ahead.
Intradermal.
Oh, intradermal. Okay, I have that. Except I have no more alcohol. And sometimes you need the help of others. What a team. Intradermal. Okay, now what do we usually use intradermal for? Everybody knows that because they had to go and get a TB test. So usually for TB. And the key with intradermal is you want to go just under the skin. You're going to place the bevel just under the skin, and you're going to make sure you get a little bleb. Okay, if you don't get the bleb, then actually you did not give it right. Or if it runs all over the skin, and that means you did not have the bevel totally under the skin. So you want to make sure you do this. Okay, now this is a medication that has a safety device. Okay, has a safety device, which we can engage immediately after giving our medication. So I'm going to clean my site. I'm going to use the client over here. His forearm is most times where it's given. And our mannequin doesn't have a lot of different sites, so give it right there. Make sure it's bevel up. And it's at a 15-degree angle, right under the skin. I'm going to provide the medication. Get my little bleb. Remove it. Wipe it off. And engage my device. Place it into my biohazard container. And you want to make sure that you don't put caps or alcohol wipe or gauze into your biohazard container. It's important because those are charged according to the weight, and you'll be filling it up sooner, and you don't want to do that. All right, Mr. Johnson, I'm going to be returning in about 30 minutes to check on you. How's everything? He's like, oh, that was really good, no problem. You want to make sure you lower your client back down, his bed down to the lowest level. Make sure he's comfortable. Situated him back in bed. That's good enough? Okay. So that's good enough. That's high enough. And he has his call light. I wash my hands. Oop, wash my hands again. Okay. Great job.